This is a stretcher operation. There's a patient on a bed laying supine on a sheet. The EMTs will bring in the wheeled stretcher and put it up close to the patient. They will then drop the stretcher to the patient's level. The EMT at the bottom of the stretcher will count to 3 and he will pull out the black handle at the bottom of the stretcher. They will lift up and then down using their legs, not their back, and they'll keep the stretcher close to their body on the count of 3.
1, 2, 3.
They'll put the stretcher below the patient. Then they will drop the armrest on the side of the patient, pulling in the red handle and dropping down. Then they will prepare the stretcher by undoing the straps and the harnesses, if there are harnesses. Prepare the blankets and put a towel up at the top of the head if necessary, if there are harnesses on the stretcher. They will then put the patient onto the stretcher, count of 3 of the person at the top of the head, using proper body mechanics.
1, 2, 3.
Making sure the patient is in a position of comfort. They will add extra padding anywhere that's necessary to make sure the back and the knees are comfortable. They will then put a blanket over top of the patient before they strap the straps in. They will put the armrest up and strap the harnesses and the other straps under the armrests and under her arms in case they need to give her a blood pressure in the ambulance. It gives better access to her arms. Making sure all the straps and harnesses are secure before they move the patient. They will then power grip the patient up. Count of 3 of the EMT at the bottom using the handles, once again pulling out.
1, 2, 3.
The patient is still in a supine position. They can raise her up if she's having difficulty breathing to a semi-Fowler position, which is below 45 degrees. They will use the red handles and push in and up. If she's still having trouble breathing, they can continue on to a Fowler's position by pushing her up to a 90-degree angle. If she is having a back issue, they should leave her in supine. If she is going into an elevator, they can also drop the bottom of the stretcher by pulling backwards on the handle, inside handle, and drop it down so that it can access into elevators easily. And the patient is ready to go. This is a wheeled stretcher operation. That's